So insurance care versus good, better, best health care. Let's define that. Insurance care is really sick care. And you know what? We do a pretty good job with that. People confuse insurance care with health care. Let me give you an example. Insurance care is when you get sick, it's kind of like your car insurance. It kicks in when your car's crashed or not running very good, or you got a dent, you got to get it fixed. You get smashed into something. Insurance care is for when you get sick. It's not truly health care. In fact, Johns Hopkins University talked about the 4 pillars of health care. And if you notice, it's diet, exercise, sleep, and mental health. Nothing in there about medications and surgery. It's about what are you doing on a day-to-day basis to bring you have the best health possible. And why is that? Why do you worry about your health care? Well, because you want to live longer, but you want to live healthier as well as you're living longer. A good friend of mine last year was 310 pounds. She's 220 pounds now, and she's out rolling around in the dirt, playing with the grandkids, having a great time. Never could do that before. Her health is even better than what it was, and she's almost 70 years old. So if you're looking for your insurance to pay for your true health care, it's not going to happen. It's truly for sick care. Good, better, best health care is what you put into it personally, both financially and your time. If you put in, according to Johns Hopkins University, time into your diet, eating the right things, putting the right fuel in to get your desired result. When you put the exercise in, so what's good exercise? When does it start? Good exercise is 5 minutes a day. Your health starts right there to improve, right there. It maxes out at about an hour a day. So somewhere between that 5 minutes to an hour a day of exercise is your sweet spot. That will give you your good, better, best health care. The best health care would be put in that hour a day of aerobic exercise. Make sure you don't forget about strength and endurance, and also flexibility. One last thing about exercise that I'd like you to even get to think about. Usually we talk about strength, endurance, and flexibility for the 3 types of exercise. There's actually a 4th type of exercise, and it's cellular exercise. You've heard a lot about peptides and other things going on in life, but that 4th part of your exercise is very, very good. And that happens when you get on a rebounder. That's like a small trampoline that you can jump on. And that deceleration, acceleration from jumping on that trampoline rebounder in your house actually exercises the connections between your cells and makes your cells stronger. Why is that good? Helps you live longer. Living longer while you're living healthier, right? It's what you put into your health care. We're trying desperately to help everybody associated with medical and health related activities, including the hospitals, all the providers, including the naturopaths, homeopaths, acupuncturists, the chiropractors, and the MDs and DOs, the allopathic people. We're trying to turn Genesee County and the surrounding area into a blue zone. A blue zone is kind of like people that live the longest and are the healthiest in the world. Italy, Japan, some places in Germany, et cetera, et cetera. You've heard of them, the blue zones. My challenge to you is, let's make Genesee County an actual blue zone. So, good, better, best healthcare. How do you accomplish that? It's really directly related to how much time and energy you put into it, not just financially, but the time you put into exercise. So go for the best healthcare you can. Instead of purchasing that $700 new purse, think about not buying a new purse and putting that money into good, better, best healthcare. Okay? Again, this is Dr. Bouvier with Dr. Renew. Have a great day.